Mississippi's COVID-19 death toll climbs to over 5,100. The State Department of Health is reporting 2,175 new cases today and 40 deaths. 1,480 people across the state are hospitalized with confirmed or suspected coronavirus symptoms. 348 of those patients are in ICU. Currently, there are only 60 open ICU beds in the entire state. Columbus and Starkville have no ICU beds open. Lowndes County is reporting the most new cases today with 71. Lafayette has 46, Lee has 44, and Union has 39. And Tishomingo is reporting 25. If you need a hospital bed, would you have one? That all depends on the day and your need. All of our local hospitals remain full with COVID patients, and in Tupelo, North Mississippi Medical Center continues to be a constant state of capacity for ICU beds. WCBI's Stephen Pimpo is live in Tupelo with an update.
That's right, Joey. I'm here live outside of North Mississippi Medical Center, where they are currently dealing with 70 positive COVID-19 patients, 20 of which are occupying their 46 ICU beds, and only one of those is available as of this afternoon. I spoke with doctors today at the hospital about what kinds of solutions they are looking for as cases continue to rise in Mississippi.
If it didn't get worse, we could hang in there for a while. If it gets worse, we're going to be in trouble.
That's the situation North Mississippi Medical Center and hospitals across the state are facing, with ICUs constantly at capacity.
Now the challenge is with that, because we're so overwhelmed, you don't have to have an ICU bed available for us to receive a patient. We actually only have to have the subspecialty care that patient needs, and then we house them in the ED until we can get a bed.
NMMC has housed up to 30 COVID and non-COVID patients in that emergency department. North Mississippi Health Services currently has 116 positive COVID-19 inpatients spread across all their facilities, the highest number yet of the pandemic. In Tupelo, NMMC has 70 total COVID-19 patients. System Chief Medical Officer Dr. Jeremy Blanchard says the main challenge is not just the number of beds, but providing everything else needed to treat the patients who require them.
It takes the appropriate monitoring equipment, the appropriate amount of oxygen, the appropriate amount of medications, and COVID patients, the appropriate breathing tools.
One solution has been to move patients who only require swing beds to long-term care facilities.
A type of bed where you don't need real acute care, but you need some care. We used to take care of those in our community hospitals. Now we move them out to the long-term care centers because they had capacity.
As well as using home health care as a resource.
So many patients don't have to be admitted that were admitted early on. We actually can send them home with oxygen. We can follow them with nurses at home.
While these methods have worked so far, Dr. Blanchard is uncertain how long that can continue.
To move our medical surgical COVID patients and non-COVID patients among our 7 hospitals has allowed us to handle it up to this time. How long is it sustainable? I really can't answer that, because part of the challenge is healthcare workers get sick too.
Dr. Blanchard also told me he is continuing to call on Mississippi Governor Tate Reeves to consider crisis standards of care for the entire state. He says that also getting the vaccine is key moving forward. Reporting live in Tupelo, Stephen Pimpo, WCBI News.